Welcome, I'm Dr. Steve Blunt. I'm an interventional radiologist, and I'd like to let you know what to expect during your procedure today. A myelogram is an X-ray examination of the spine in which we inject X-ray contrast into the fluid that surrounds the nerves. The purpose of this examination is to evaluate for the cause of pain or numbness that you may feel in your back or neck that extends to your arms or legs. For this examination, you'll change into an X-ray gown. You'll be taken to the procedure room and laid on a table. Your skin will be cleaned with betadine, an iodine-based soap, which may feel cold against your skin. Your skin will be numbed with an injection of lidocaine, a numbing agent that usually causes a temporary burning or stinging sensation. After your skin is thoroughly numbed, the doctor will use an X-ray camera to guide placement of the needle where it needs to be. Once it's in the fluid that surrounds the nerves, the X-ray dye will be injected. When it's injected, you likely won't feel anything. It is possible, however, to feel a heaviness in your hips or legs, a light headache, a fullness in your ears. Rarely, patients may have an electrical sensation or temporary increase in their pain. These symptoms don't last very long. Once the injection is complete, we'll remove the needle and apply a Band-Aid. If the part of your spine to be examined is your neck or upper back, we'll tilt the table steeply downward in order to reposition the contrast to the appropriate part of your spine. Once the contrast is appropriately positioned, we'll flatten the table back out. We'll take some pictures, and you may be asked to roll to improve the angle at which the pictures are obtained during this portion of the exam. When the X-rays have been completed, you'll be taken to the CT scanner, where we'll take high-resolution detailed images of the affected part of your spine. After the myelogram, it's important that you rest flat with your head slightly elevated for about 8 hours after the procedure. You should resume your normal diet and medications, drink plenty of fluids. It's important that you not engage in intense physical activity, including exercise, heavy lifting, or physical therapy for 48 hours after having had a myelogram. Also, you shouldn't drive for the rest of the day after a myelogram. Keep in mind, anytime a needle is placed through the skin, infection and bleeding are always possible risk of a procedure. If you should have weakness in your lower extremities suddenly after the procedure, that would be an important reason to contact our office. Nerve injury or seizures, although reported, have never really occurred in our practice, but you need to be aware of their potential complications. It is possible to develop a headache related to the procedure. This may not manifest for a day or so after the procedure. It usually is worse when you're sitting or standing up, and it's relieved by laying down. Usually laying down for extended periods of time will cure this headache. Rarely a procedure is needed to treat this type of headache. Before the procedure begins, a radiologist will be available to answer any questions you may have. Our team strives to provide the highest level of care possible. Thank you for allowing us to participate in your care today.